guess I've done a fair bit of research into infection and diet purely because I've seen so many specialists that have given me no answers at all. How do you think we can make this more worldwide known or raise awareness for it? Is it just going to be word of mouth because people will start feeling better and telling other people who start feeling better, or...?
Well, it's going to take education.
Yes.
It's going to take education at the professional level, but it's also going to take education of patients as well. We need to educate patients so they can demand better care, demand better treatment. We need to educate physicians so that they're aware of some of these possibilities, and many aren't. And many are still mired in some of the old traditional ways of thinking about autoimmune diseases or neurodegenerative diseases or fatiguing illnesses. And that's not very helpful. So we need to do it at two levels.
One of the neurologists that I saw, despite saying that I'd made some changes to my diet and was starting to feel a bit better and added a few supplements in that you'd mentioned before, which I could improve on now that I know about the lipid replacement, said that the diet and lifestyle modification and infections is just spooky stuff.
Well, these are generally people that have been trained in the last century. They don't really read the literature, so they don't have knowledge of what's current in the medical fields. They've more or less stood still. And that's more or less of the science in medicine of the last century. That's not the science of medicine of this century. So we really have to get people thinking ahead, thinking of current ways in which we deal with these problems and not go back to what was done and didn't work in the past.
Do you think it will eventually be part of a medical degree? There'll be an element of medical degree at universities where...
Well, this goes back to, the root problem, is education. I mentioned education of the general public, but of course then there's medical education as well. And unfortunately, these concepts are not taught at all in medical schools, anywhere. And this is where it has to start. But it's also the toughest, getting medical schools involved in teaching this type of thinking in their curriculum.
Anything else you'd like to add, Garth?
Well, after teaching for medical schools for many years, I can tell you that these subjects and these concepts are not taught in medical school. And this is one of the primary reasons why when you go into your physician, he or she has not heard about these concepts and has no way to evaluate them. And they tend to just ignore them or to dismiss them.
So would you say that alternate therapies do play a role, like naturopathy or dietitians do play a role in helping?
Massage therapists.
What?
Massage therapists.
I think that everybody plays a role in this whole problem.
So it's a holistic approach rather
Well,
than...
I think you have to take I prefer the word global than holistic, because holistic has been misused so much.
Yep, I agree.
A global approach means that you try everything at your means that helps. And this can involve a variety of different disciplines, a variety of different fields, a variety of different approaches, all of which can improve a patient's health. And I think that's the way we have to look at this. Again, I think this is something that's going to slowly change, and it has to change because we're not doing it effectively now. We're not treating chronic illness effectively because we're taking too narrow a view of chronic illnesses. So we need to spread this out, we need to broaden this out and consider all the alternatives and all the different approaches that need to be brought to bear. Now, some of the most innovative clinics that deal with these problems all deal with it on a global scale. They don't deal with it in a simplistic way because they know it doesn't work. Dealing with these things in a very narrow way does not work. There is no magic bullet, there's no magic drug, there's no magic cure, no magic treatment on these things. It just requires a lot of hard work. Each patient is different. Each patient has a different genetic background, a different susceptibility to all these different parameters that we've discussed. And so you have to really tailor therapy to the individual And that really means that you have to investigate their specific problems, not as part of a general scheme, but as part of their problems, their collection of problems. And generally, the collection of those problems means that the problems come from a number of different directions. They're not just coming from one direction. So you have to have an idea of all these different parameters and how they fit and how they're involved in the overall disease process. Now, we're living in a modern age where we see much more contamination. We see a deterioration in diet. We see a deterioration in some of the things that are very important as individuals, like getting the proper exercise, for example, and so on. So all these things play a role, I think, to some degree. So that's another reason why we have to take a very global approach at all of this. So I'm a big one for example, not just considering exercise therapy, but considering exercise therapy as an important adjunct to everything else that we do. Diet, exercise, healthy supplements, and so on. All these different things. And then more specific approaches to specific problems, like chronic infections, for example, or other things that may play an important role, like heavy metals and so on. Those things can be approached specifically, but I've always told people, particularly patients that have asked, and I've always said, you're never going to recover if you just take a very simplistic approach, because you've got to deal with all these other factors as well.
So would you encourage patients like myself who have just been told repeatedly that it's a psychological problem, or
that is the worst thing in the world that a physician could tell you, is it's all in your head, that you don't really have a problem. It's because they can't see their limitations, not yours. They can't really see all this interconnection. They can't see all the nuances of your illness. So they're just dismissing you.
And I guess as a patient myself, even having an allied health background and doing a lot of research, I even started to think that it was a psychological problem, because there's only so many times you can get told you're nuts before you start thinking you're nuts.
Well, in defense of physicians that have to deal with a lot of neurotic patients, this can be very difficult. And believe me, I've had a few people that have come to us and they were totally neurotic. And these were the most difficult patients to deal with. They really were. But once you started to unpeel some of that neuroticism, usually there was a basis for it.
Yes.
It's just that your average physician does not have the time or the inclination to delve deeper into these problems and really get at some of the nature of these problems. So they just check it off as this person's neurotic. It's all in their head, and it's just an easy way to dismiss it. Next patient. And I think we have to get away from that.